You are listening to the Dental Business Mastery Podcast, where you discover management insights and strategies for your successful dental practice. There are also interviews with key people in the industry who have advice and services to help you and your team achieve great success. Welcome to this episode of the Dental Business Mastery Podcast. And today you've got me, Julie Parker, a co-founder of Dental Business Mastery, Ameena Basile, the other co-founder of Dental Business Mastery. And the guest that we have today is such an important one. And this has been something in the making for a number of months, ever since I spoke to a particular person, a fit-out person within the dental profession, who talks about some of the sad stories out there. And because of these sort of sad stories that we're going to have shared with us today, Ameena and I are co-hosting an event on March the 18th down here in Melbourne, and it's going to be a panel of experts just speaking to dentists that are looking at building their own practice. And so this is why you will find out very quickly why this interview is going to play such a big role in recognising why that session is going to be so important. Welcome to the podcast, Dr. Jenny Liu. How are you?
Hi, Jenny.
I'm good, thank you. Hi, Ameena. Hi, Julie.
So, Jenny, you're not actually in Melbourne at the moment. Whereabouts are you at the
I'm
moment?
in Thailand at the moment.
You're coming from far away. Is that a holiday, a learning opportunity?
I'm here to learn diving, so it's technically learning, but not for dentistry.
I've actually got my PADI license, which I haven't renewed for a long, long time, so I don't actually have it anymore. But I've got a story, later on where I had a deep dive from hell. I'd had a panic attack at 30 meters underneath the water. So anyway, that's another story. That was one of my last dives.
Oh, gosh, yeah.
But there were a lot of extenuating circumstances around that one. Jenny, you're going to love it. It's such a wonderful thing, the diving. Well, I just realised what I'd done there. I put yourself in a bad headspace for it.
Oh, that's all right. Fine. We're in the pool today anyway. It'll be right.
So, Jenny, some people would have seen your story in the February edition of the Bite magazine. And for people who are tuning in on YouTube, Jenny is pride there on the very front cover, glorious woman that she is. And what we're going to be talking about today is Happy Dentistry, your dental practice in the heart of Melbourne.
Mm-hmm.
And you purchased that in 2023, is that correct?
Yeah. Well, 22, end of 22, but yeah.
End of 22.
Mm-hmm.
So tell us, what led you to that position, first of all, of buying the practice?
I think I got bored with being an associate. That was pretty much it. It felt like being an associate would have been like Groundhog Day. So decided to do something different.
That's nice. That's nice. And actually, my husband, Charles Coves, Australasia's passion provocateur, he was at the World of Wellness yesterday doing a presentation, and he was talking a lot around freedom. And I found a lot of the notes that I was making was around dentists. And, that's one of the reasons why you do own a dental practice. One, it could be to relieve the boredom of being an associate. But have you had that sense of, well, I would like to have further control and more freedom to control my working environment and my career?
Yeah, I think so. I think it's certainly not for everyone, but if you really like having that control and you like being able to call the shots, then I think it's something you'd really enjoy doing. But with the control comes the responsibility, so you've got to kind of be able to take both. Some people like control but don't actually want responsibility. If you don't want responsibility, also don't do it.
That's for sure. And part of what Charles says as well is there's benefits and drawbacks in equal number to everything we do. And that's what it is, isn't it? To achieve all that benefit of owning your own practice, you have to be willing to put up with the drawbacks.
Absolutely.
So tell us about moving into 2023. Did you buy the practice as an ongoing concern?
I bought the practice, but it wasn't really what I would call like fit for practicing when I bought it. It was, really, really old. Like the dentist was on his way out, retiring. And he was, an elderly man in his 80s. So the practice, I would describe it like a time capsule. It looked like it was something from, the late 1900s. So I made a decision to renovate, and then I think you know, yeah, it was my first time kind of navigating all of it, and I didn't know, enough people in the industry, so I think I made some poor choices.
It's such a space. You're going in so green, aren't you?
Yeah,
I mean,
yeah,
if
yeah.
you had to write a book now about how to do it, you'd be able to write a book about how to do it. But the only way to get to that level of information and that knowledge is to actually move through it quite often.
Yep, yep, absolutely.
So, what was your experience like?
Uh, Honestly, I think probably because I was quite young when I was doing it, and I didn't have the network or the knowledge. I think I was very probably too relaxed with it. I was like, you know what? I didn't set enough boundaries. I didn't set enough parameters, and I was just like, I'm going to trust that whoever I chose are professional enough to do the job. You need to do a lot more oversight. Um, and you need to actually push a lot more, because if I think because I was too chill, that they felt like they could also just kind of take the piss a little bit, which I think was definitely part of the issue like during that renovation and fit out time. And I think again, like, unfortunately, you we're kind of in 2026, but Um, it is still very much a male dominated space. Like dentistry isn't, but when you go to like, dealing with builders, contractors, everyone else kind of adjacent to dental, it becomes a very male dominated space. And they don't tend to take young women very seriously. Or like you really have to probably overcompensate a little bit to for people to kind of take you a bit more seriously sometimes. Depends on the person, obviously, but I would say that was probably also part of it.
I've seen, in my experience working in dentistry and then coming from a family where my dad was a doctor, my brother's a doctor, that I
Mm,
think even it happens to the men as well, that there's this, some people who will take advantage of the fact that you guys are very intelligent individuals that are so engrossed in doing your clinical work and your science and
yeah,
not really exposed to all these other factors that unfortunately there are people out there that take advantage of that. I've seen it with accountants and so forth, and I've recently my brother, who's a doctor as well, looking for a medical practice. He's been practicing for a long time, 20 years thereabouts, maybe a bit more.
yeah,
And he knows what he doesn't want. Like, he doesn't want to work in a practice like this, and this. And what he does want, he wants to work in a practice where he's got control, where he can practice that way he wants and all the things. But all the other things outside of that, all the legal things that to look for from a business perspective and so forth, I was surprised even when I discussed with him after this long in practice how much knowledge he was lacking in that space to make those kinds of decisions. And I think he was too when once we had some discussions. So
yeah.
I think it does. And I think there's that gap, isn't there, between getting the knowledge to go out on your own into a practice and knowing what you know from practicing.
Yeah, there's a huge gap. I think, yeah, medicos, we tend to, well, doctors and dentists, I don't know. Some people don't like classifying dentists as medicos. Maybe we're allied health, who knows? Um, but yeah, we tend to really narrow in on just our field of expertise, and we don't really care about much else.
And I suppose, in essence, there's a couple of scenarios have come into my head. Number one is when we have patients coming through, it's like a patient trying to make an informed decision for their own health without knowing all the details. And it's also like, you're about to build your own home. Oh, I'll do it without a contractor and without all the best advice in the world. I'll just kind of source it all myself. And so I think it's certainly a space where when you look at it through in different perspectives, you go, of course, we need as much advice as possible. But it's about, where do I go for that advice? How do I actually trust these particular people that are involved in this process? How did you go about getting the people and getting the project happening of the renovation of the building, of your space in that building?
Oh, the first time, my banker was really helpful and gave me some contacts. But obviously, like, my banker knows the people, but he doesn't actually know who's good, who's not good, and he's not a dental person, right? So, like, he knew these people worked in the space, but that was probably limited information. And so he did put me in touch with people, and I kind of went from there and just reached out to these people and, got everyone to come in, have a look, give me project proposals. I went through all of that, but I also think, especially when you're starting out, I think because the financial stresses are so high, you tend to have or at least for me, I had a more interesting value system where I wasn't really thinking about, all of the factors that kind of played into the cost as such. And so, I ended up choosing someone that I think, had I chosen someone else who'd submitted a proposal, probably would have given me better results. And they were more expensive, right? And this stressed me out because, when you buy a clinic and all the costs are all of a sudden like astronomical, you don't really focus on anything else except the money side of it for a bit. And then, I don't know, sometimes you quickly realize that the money's not the only thing that you should be concerned about. But I think, again, some people can switch from that mindset and some people don't. So,
Well, you look at all of the belief values that drive how we feel about money.
well, absolutely, absolutely. So it's a hard one, but yeah, I think I, after I got into the space and set everything up and everything else, and then I quickly realized a lot of it wasn't quite what I wanted it to be, or a lot of it wasn't actually up to my standard, and then I didn't actually like a lot of these things. And then I kind of had to go back to the drawing board and rectify a lot of the mistakes and, get the right people in, and then kind of, do a little bit of a do-over, so to speak, in a few things. So, it probably actually ended up costing more. But you don't think about it when, you're starting out. Like, it's a hard one. Yeah. Whereas, if I were to do it again, it would definitely be more a once and done kind of project. There wouldn't be all of this toing, froing, headaches, changing everything.
So give us an example of a few things that didn't go as according to plan that you kind of had to redo or you're unhappy with.
Oh, so many things. But I ended up changing my IT provider. That's how I knew Mike, because I wasn't happy with my original one. They were relatively well priced, but then Mike came in and was like, haven't had a backup on these things in ages. And I'm like, okay, that's really good to know. That's a problem.
And you're talking about Mike Collishaw of
Yeah,
32
yeah,
Byte.
yeah, yeah. So, like, and then I realized that my IT providers weren't actually doing what I needed them to do. Um, you know, and so yeah, so then I ended up changing over to Mike, and he's now managing all of my IT things. So there was definitely that. It was like a lot of things, like I didn't make the correct provisions for my compressor and suction unit. And again, with the original people who did my fit out, I went, well, this is the compressor, this is the suction I'm using, but they made the spec so tight that it only fit that compressor and that suction unit, which is bad because, if that compressor or suction unit breaks, you're in a lot of a pickle. So once I got built in, because again, my compressor or suction unit got old and broke and all of those things, generally, as they do when you buy something from a older dentist. Yeah, That was really, really good.
And so you're talking about Bill Stoney of Aldent, and they've been a fit out company. Bill's been in the industry for 50 years. So tell us more about how Bill has helped you out.
Yeah. So Bill had to really just, come in with the new units and things, but he had to literally cut that cupboard and, do a lot of Tetrising and lots of creative things to get my units in. So it's definitely been fun. Lots of problem solving in hindsight, which shouldn't have happened.
And you're highlighting just how many people have a finger in the pie. The IT, the fit out, the equipment, the finance. Who else was involved?
I mean, there's like the marketing side was also really important, but I got quite lucky. I've got an in-house marketing team now, or someone who helps me more that's in-house. But yeah, I realized that the original, one of the dental marketing specialists weren't actually doing anything with the marketing. And the SEO strategy wasn't great. And, my marketing girl took one look at it, was like, why are you paying this much money for it a month? This is again the hard thing, right? Because anyone who's like adjacent to the space kind of knows, um, you know, that again you're a premium service, therefore you charge a premium, therefore they charge you a premium. But sometimes they charge you a premium without actually doing the work. And I think a lot of us are really, really tied to, for example, oh, we need a dental marketing specialist, but do you really? Are they actually doing the work? Um, And like I'm not happy with my website and I paid quite a lot of money for it. And, I'm redoing that whole website. And that's also been a journey in itself because, again, originally I had a URL that was like, I think dentistcbd.melbourne, which, the original marketing company advised would be better for like SEO purposes. But I think like at the end of the day, after like actually talking to, friends in marketing, other people in marketing, made the decision it was actually too difficult because, having your email end in dentistcbd.melbourne was really, really hard for people. So actually, then had to really change the website URL from that to like happydentistry.com.au, like at a normal clinic. And then but yeah, everything's been a continuous saga. Like I'm getting my website redone now, so that, it's actually up to scratch. It's, it's built properly. It's not bloated because the original website was built on WordPress and, it just wasn't right. Like if you go onto my website on mobile, it's clunky, it's awful, it's not very patient friendly, all of those things. And, like constantly what holds it back is the fact that it's so like high data use, I would say. Like it's just got so much data like that. The website speeds are slower and all of those things. It's like, so it's a little bit of everything. You've got to kind of be across it all.
So, Jenny, when you set out to go and buy a practice, did you seek help and guidance from anyone in particular to take you through the journey, or did you navigate it on your own?
I did some like practice ownership seminars and workshops. So, and I joined like DPO, dental practice owners, and all of that. So, and then I did engage with like some dentists that were also offering like dental business coaching. So I did bits here and there. I wouldn't say I had like an advisor that really held my hand through all of it. But yeah, definitely had help. You can't do it by yourself. It would be awful.
On reflection, do you think it would have been helpful if you engaged someone sort of full time on that journey to help you through?
I think it depends on, again, how hands-on you want to be with it because, there are dentists who probably just don't want anything to do with the management side of the clinic. And, like once they get set up, they're going to get a dental practice manager and they never want anything to do with this side of it. So, and they still want to practice, what is it, like full-time clinical hours as they're doing this. It's not feasible, really. If you want to do that, something's got to give. So yeah, if you're like only working 2 clinical days a week, you probably are okay with getting less help and figuring out some stuff on your own. But if you're wanting to work full-time clinically whilst opening a clinic, you need help. You need help. You need all the help you can get.
And you're kind of highlighting something there when you said, working clinically 2 days a week. This is the other aspect, isn't it? That when we go down the path of doing renovations in the practice or starting a practice from scratch, how long is it going to take? And if all the contractors and everybody else says this is how long it should take us, we can never rely on that date because it's always going to take longer because that's the way life
Always
works.
going to take longer, and even if you build it in, it's still going to take longer. Costs will blow out. So yeah, it's almost like, there's things I wish I'd done, like sign fixed price contracts that I'll do now that I didn't know to do. And then your contractors submit variations, and of course you have to do them. But yeah, there's like, all the things you weren't aware of. And then, like, I think I was doing a clinic right about the time where like the radiation management plan things started happening. So like, prior to, you didn't need those and all of the stuff, right? And it's like things are constantly changing. Like all of a sudden you have all these new infection control standards that have come out that are confusing the hell out of everybody. And so now when you do a new fit out, you really have to consider what those guidelines mean and not what the old guidelines were. And so yeah, things constantly change. So you definitely really need to either stay on top of it or really, really need some help externally.
I remember years ago someone saying to me that where to place a dental implant would depend on which specialist you're seeing. Where a prosthodontist would place it is quite possibly quite different to where a periodontist would place it, which is quite possibly different to where an oral surgeon would like it placed. All these different people would be putting this, and even the lab technician may have a completely different, because they're looking at it through their own lens. What do I need from this in order for me to get success with my part of this? You were talking about, that's true, to get one person that can actually take all of these different things into consideration, and who is also on and up to date with all of these sort of what's going to be changing in the industry. For example, I think washer disinfectors now are required in any new build of a steri room, and something that not everyone's just going to naturally know that information. And so I know that one of the people that is helping us arrange our March event is Mindy Green of Smart Dental. She's been working with ADEC for many, many years, and now she's like a project manager for dental fit outs. So helping people to really be aware of all the many considerations that they need to take in to their brain in order to roll out a successful job and project. And I think what you said too, information around and learning the lesson of fixed term contracts as well, enormous. Because if there's all, I suppose every contract is going to have a get out clause that if things take me longer, bad luck. But to be able to tie that to the financial compensation that they get, so they've got a true motivation to actually have that sense of momentum and importance over getting this job done. So what other lessons have you learned about your journey? If I was coming to you and saying, okay, Ameena and I are building a practice from scratch, what's our best next step? Who should we be talking to? Because this is a big part of it, isn't it? Don't go by the testimonials on these people's websites, because they can pick and choose what testimonials are written there. But how would you, if you had your time again, how would you find the trusted individuals that you'd utilize for a project like this?
I think, like, for me, obviously, I went the trial and error way and I learned everything the hard way. I don't know if I'd recommend doing that. But then again, like, it's probably very congruent with my personality. Like, I have to know what's good and what's bad for myself. Some people have to learn the hard way. Not everybody, but that's definitely the path some people would take, and they wouldn't do anything else. So in a way, I think I'm probably one of those people, right? Like, I know the people I have are good because I've seen what bad looks like. So, you know, but, and I think a lot of people have that mentality of how bad could it be? You know, surely they do all the same things. That's not the case. Not once you actually kind of understand or figure out how good the good people are, you know. And it's the whole, you know, I can call Mike up on a weekend, and if something's broken, he'll hop on and fix it for me. Sometimes it's not him personally; he has a life. But yeah, I can call, you know, I can call on weekends. Clinic's open 7 days a week, so it's, and of course it's always broken on the weekends. It's never broken midweek.
That's right.
But yeah, it's the same thing with Bill. You know, I can really just call him. You know, if something's broken on a weekend, and if it's really bad, you know, he'll either help me troubleshoot it, or when it's real bad, he will come in. And it's one of those things, right? And yeah, there's like probably little considerations you want to think about, like how close is this provider to you geographically, physically, right? Especially like your equipment guy. Like, Bill's great, and Bill's down the road from me, right? I'm in CBD, he's in Port Melbourne. It's very helpful.
Yeah.
Because it means like if I need something, he's just down the road, and he's not, you know, far away. Obviously, it's a lot harder when you're rural because of this. And in rural, you've almost got to build in more fat into the business, and build in more backups so that when things screw up, you can do a bit of DIY a lot of the time. Because people aren't going to be able to get out to you. Like, it's the unfortunate reality of the world. But if you do have choice in the city, don't go for someone like on the other end. You're going to regret it, you know?
Yeah. I remember back in the day when I was a young dental assistant back in the, what was it, late 80s, early 90s, that it was so, if all the equipment broke down, we had systems in place to be able to still see patients. We'd have those little bubble things to be able and fill one with water and one wasn't filled with water, so it had air in it, and that would be our irrigation and air drying and things like that. They would get the spoon excavator out and dig out decay, and we didn't necessarily need a light curing light because back then it was amalgam, so that was all groovy as well.
Mm.
It just seemed to be able to be easier to muddle through if things broke down. But nowadays, of course, if you don't have an electricity, you don't have the client files. And so what are you supposed to do? And you can't take x-rays and all these other things. And so I think it's tougher now to continue on seeing patients when things go awry. So having those kind of backup plans are wonderfully important.
Yeah, you've actually got to really think about what you're going to do when things go wrong.
Tell us a little bit about the financial aspect. And so, did you find that you got all the quotes and you went to the finance institution? You said, "This is the money I need," and they said, "Sure, here you go. This is the pathway to getting all that."
Mm.
And was that a simple enough process, or did you find, because of the fact you were doing redos, that you found you had to go back to the finance institute and say, "I need a little bit more"?
Yeah, I had to go back and ask my banker for some more money. Absolutely. But that's fine. Like, you know, I've been working with BOQ specialists the whole time, and they've been really, really good. Like, I love my banker, so, you know, he's an absolute sweetie. Yeah, they've really looked after me, so I haven't really had an issue there. That's actually been the least headachy of all the processes. So yeah, and I mean, if you are running the business well enough and the numbers are healthy, like, the bank will give you money. That's what it comes down to, right? If you're not running it well, then, you know, you've got probably other bigger problems to worry about. So I think I was very lucky in the sense that financially there's not been an issue because the business has always done well enough so that the banks have been happy to give me the money. Yeah. And again, if you're struggling finances wise or business wise, then you've really got to think about how to solve that as problem number one before solving for the other stuff.
And reassure these banks that you will be profitable as quickly as
Well,
possible.
exactly, right? Because at the end of the day, it's like I have a good relationship with my banker, but like I've also paid all of my loans on time and, never missed a payment and all the rest. And there's always been money in the account. Therefore, of course, the banks don't care.
Actually, you're highlighting another really important aspect, and this isn't just for new business, new practice builders and fit outs and all that sort of thing. It's for anybody in business that the business does go through ups and downs over the years.
Yeah.
You might need a bit of generosity of spirit from them every now and then. And in order to pave the way for that, then do pay all your bills on time. Don't make people chase you for money. Don't be rude when you're dealing with them. Create strong relationships. Give everybody a reason to try to make you happy and do things for you.
No, absolutely, absolutely. Yeah. So I don't know if Mike told you about the time the clinic flooded, but that was really fun. So yeah, it's also really important to set up your insurances early because you never know when things will go wrong.
Very good. So how long into the journey did your clinic flood?
End of 23, like during like November, December, when it's like the busiest quarter. So yeah, that was good. That was really good.
Man alive. You had one thing after another after another.
Yeah. I learned everything the hard way. I really learned everything the really hard way.
How long were you up and running?
Less than a year. I think we were about 10 months at that stage. I'd like started running in start of Feb 23 and we flooded in November 23. Yeah. So yeah, again, business interruption insurance, like all of the things that just get it all sorted early.
Yeah. And what about kind of carrying your team through all of these changes and things like that? Was it disruptive to the team when they were working in the environment that actually ended up needing to be changed, even though it was all fresh and brand new?
Well, I only started off with like one staff member I inherited from, the old dentist. And then at the start, it was definitely a learning curve again, choosing staff, right? And you all of a sudden go, okay, I have to interview people. What skills am I assessing for? Blah, 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 blah. Again, like with ChatGPT, you can kind of ChatGPT your way through some of this. AI is very helpful, but you still have to learn how to do it. Like, AI can give you great interview questions, but if you don't know what the interview questions are asking or assessing for, you don't know how to judge, hey, this is a good response, this is a good response, this is a red flag, this isn't a red flag. AI can do some of the work for you, but it can't do all the work for you. So initially, I chose some staff members for like my reception, and I quickly realized that, none of them were the right fit. And then, again, back to the drawing board. So at the start, I probably had a little bit higher staff turnover. But like now it's pretty good. Like I have probably, I would say, like, 6 or 7 dentists. None of the dentists. I've had one dentist leave because she went overseas, had surgery, and then she came back and bought her own clinic. But yeah, like I've barely had any staff turnover since. But the start was definitely more staff turnover, lots of learning, and really kind of trying to understand what you needed. Because again, everyone's criteria is going to be different because they have to work with you and your clinic. So there's no like right or wrong, so to speak. It's just what will work with you and also what you can afford and how much training you want to do, because someone with experience is going to want a lot more money, and you can't have someone who's experienced and not pay them well. So you've got to kind of choose what you want to do, whether you're happy to build people up more, and maybe, you don't pay as well, but that's okay. And, there's all the talk about pay structures. Do you pay them above award but flat rate? Do you pay them at the award but pay them all their overtime and their weekend rates or whatever else you want to do?
It's a lot of stuff to know and learn. And you're right. We have to move through it to understand how it all relates to us and how it's going to change our journey and our path moving forward as well.
Yeah.
And the team right is something that Ameena and I will certainly be talking about at that March event, because it's such a crucial piece of the puzzle, because everything ends up coming down to that patient experience, and the team are the ones delivering this patient experience. And how have you found the transition of patients from the old owner, and I don't mean old as in age, he might be young in spirit, but the previous owner, and the growing team and the changes that the patients saw and attracting those new patients? How have you found that patient attraction and retention journey?
Look, like that, the previous dentist probably had quite a aging patient base. So unfortunately, there's just naturally a high attrition rate there, so to speak. And because I'm in the city, like, people, especially after COVID, they just weren't going to come into the city anymore. They'd gotten sick, they became really unwell. Unfortunately, a fair amount of them passed away, all of those things, right? So there was naturally a high attrition rate in that goodwill base I already bought. But in terms of the transitioning, the people who, did stick around with us. I mean, what was really helpful was, I did keep his nurse. Her and I have a great relationship. She's pretty much doing all of the practice managing side of things for me now. So, it's really good that, she was there and, she eased that transition, because they were so used to talking to her on the phone. They were so used to, her being there, all the rest of that.
So she's played a big role in making that journey easy for yourself and the patients.
Well, absolutely. Because again, it's like when she was there, it was that reassurance of, hi, I'm still here. I did keep the older dentist on for about a year and a half as well. And he continued to see some of his patients. And he was only there 3 days a week, and then, tapered him down more and more and more. Just as a way to slowly transition. So that was really necessary too. And then, making sure that when he did do the transition, that again, there was a lot of reassurance. And then, one of the dentists I think I ended up hiring was, had very similar language skills to him, probably even looked like him a tiny bit, but much younger. So I think that also helped, because it was just getting someone, because again, patients get really funny about these things, right? If like the principal was a man, like it's going to be easy for them to transition to a male dentist a lot of the time, because that's what they're used to, right? So if you can,
That's it. That's fitting more so with their expectation of what they've grown to love and trust in the previous owner over the decades that they've.
Well, exactly. So it's about, probably just trying to find that and doing that.
Well, we're so delighted that you're going to be present and involved in the March event. And just to give people a bit more of an idea about what's happening at that March event, it in essence is a panel of experts in front of an audience of people who were in Jenny's position back in late 2022, early 2023, where you've got a lot of decisions to make. You're going to have to depend on a lot of external people who are going to have a direct involvement in your project and how profitable and how quickly you can be profitable after the project has been completed. And it is so crucial to get people who are experts in their field, who have been in the industry for many years and so have seen a lot of these sort of things go wrong, so they know exactly what to look out for to help make it go right. And we are talking about probably one of the most stressful things you'll ever move through is huge financial impact and decisions to make. But if it does go wrong, the amount of stress would be absolutely extraordinary. And depending on how well you manage stress, it might really be one of the most impactful times of your life. And so we wanted to get a whole panel of experts. Each of us are going to just speak only for a couple of minutes about what we do and what role we play in the profession. But then the rest of the time, and it's going to be like an hour and a half, where we're just going to be fielding questions from the audience. And so it is such a beautiful time to get great advice. And just to give you a quick idea of the lineup of speakers, our MC and speaker on mindset and confidence is Charles Cobest, Australasia's passion provocateur, 73. History of being a lawyer, has had decades of providing business advice over the years. We've also got Peter Nicol from RSM Accounting. He's going to be talking about business structure and the accounting setup. Michael Evans from MedX Finance. He'll be speaking about securing the finance and managing cash flow, which is huge to manage cash flow effectively. Jason Carroll from Calibre Designs. He's cabinetry and practice fit out. Bill Stoney of Old End, and Jenny, you've mentioned Bill already, and he is around fit out. He's just recently, this past year, celebrated 50 years in the profession. Mindy Green as well. We spoke about Mindy before, equipment selection and contractor selection. And so she is going to be that expert in who to tap into to be able to get this project underway. And Ameena and myself will be speaking also. We've got another guest speaker who's gone through a similar journey where there's been lots of ups and downs in the fit out process and developing her own practice. And so she'll be there to answer a few questions, and you'll be there as well, Jenny. So what would you say to people who are thinking about buying a practice? Number one, they've got to come along to this event so they can get a whole bunch of information. It's going to be a great research opportunity, and it's only $50 a ticket, and there's $7,500 worth of value in their gift bag when people do turn up. So it's just a no-brainer. If you're in Melbourne, come. We've even got someone coming in from interstate as well, because they see it as such an important event. What advice would you give to somebody who's looking at going down this path? And it could be anything from mindset to contact these specific people to watch out for this. What kind of comes to your mind?
I think you really have to think about why you're doing it, because I think it all really just starts with the why of it. If you're not doing it for the right reasons, like you said, it would just be an awful, stressful time, and, you wouldn't actually get any value or any joy out of it. So, yeah, you've got to really be clear about the why before you even go to the how, Yeah. Because again, it can really you can just have a mental breakdown, you know what I mean? It's a lot. And if you don't like it, you've put yourself into, essentially like a prison of your own making. It's absolutely hell. And unfortunately, there's no way out, really, because, the business isn't worth very much until you actually get it up and running and profitable. So
that's a really good point to make. It's not worth anything. And especially at the start, if you're getting finance for all the equipment and everything as well, it's a debt.
Yeah. It's not an asset until it becomes a actual functioning, running dental clinic, and that can take years,
It can take years, and set yourself up on the right footing. And even though at the time, yes, everything's expensive, so you'd be inclined to use people that maybe are a little bit cheaper, and maybe they're a little bit cheaper because they're newer to the profession. What you have found is that can bring about a whole basket of problems that are unnecessary if we just go and do our due diligence, research, ask a lot of people, who did you use, what was your experience like, to be able to get the people involved who don't just want to get the money for the job, they want to make sure you get the result that you want.
Yeah, absolutely. I agree. I don't know. It's so hard. You could talk for days about this, but again, everyone's going to have their own approach to things, and everyone's going to have their own way of doing things and what they think is right. Like, what I think is right is just for me. It's not for everyone,
Yeah. Nicely said. Nicely said. Ameena, anything else from you before we wrap up?
No, but thank you so much, Jenny, for your time. It's been great to have a chat with you today.
Thank you so much, Ameena. Thank you so much, Julie. It's been lovely to meet you guys, and I'm looking forward to meeting you in person at the event.
That'll be fantastic. Good luck with your scuba diving. You won't need luck. It'll be fantastic. You'll have beautiful things to see in the water.
Thank you, guys.
See you later. Bye. If you enjoyed this podcast, then I encourage you to head over to Ameena and my website, dentalbusinessmastery.com.au. You will find all the information that you need if you would like to gain our assistance in helping you and your team achieve great success. If you would like to find out more, you can also email us directly at info@dentalbusinessmastery.com.au. Thanks so much for listening.